Hey everyone, I'm delighted to have Simon Rost of GE Healthcare today with me. Simon, how are you?
So far, so good. Thanks for having me.
Well, thanks for being here, and such a fan of not just GE Healthcare and the amazing work you do, but you and your biography, your work. You're very active on social media. I always enjoy consuming your content. Maybe start with that. Introduce yourself and your role at GE Healthcare.
Happy to. Look, first I give the compliments back to you, also a vivid follower of your content. And look, you will already hear that by accident. It tells I'm not a native speaker. I'm from Germany. I always try to hide my accent, but it's impossible, apparently. With GE now for over a decade in various commercial and marketing positions. And my latest position right now for the last 1.5 years, I'm leading marketing for our solutions for enterprise imaging business. So think about software that helps you to basically bring together diagnosis falls under that in a global position. Happy to be here.
Well, happy to have you. And you're paving the way in areas like digitization and AI and radiology, of course, with the big RSNA conference coming up. It's maybe in an ideal time to chat, although you can't talk about some of the new announcements. But let's dive right in and talk about AI tools in healthcare, something you know a lot about. You're doing really cool work with on-device X-ray AI algorithms and using AI to improve patient care. What's the high level vision there when it comes to your GE healthcare mission and all of the new innovation you're doing in AI?
I mean, look, for me, it's always, if you think about technology like artificial intelligence or any kind of innovation, there's three questions that you have to ask yourself. From my position, being in charge as a marketeer, the first one is, where is it applied in
Mm.
the healthcare sector, or in our case, in the hospital, because it's our main customer at this point in time. Second thing is, what does it do? So how does it actually help the healthcare professional? And the third one, from a marketeer's standpoint, is there a market for that, right? Because many times we have innovation that's not yet market ready, or where people would not invest into it. If you look into where it's applied, there are plenty of studies out there that have in PubMed that have the title of AI that gives you already a first, let's say, feeling of which specialty is using most of the artificial intelligence. Radiology is very much at the forefront there. Has been in the past. It's let's say the radiologist or the physician in a hospital or in hospital systems are the one that are likely ahead in digitization compared to others. The second thing is, what does it do? There are many things where AI today can make a difference, right? Typical concepts are triage, where you can see, hey, why is, for example, Simon treated first and not Evan? Because Simon likely is a little bit more severe sick. Their AI can help you already to say, hey, treat patient A first, patient B can wait because of certain things. A second big one is it augments the capabilities. In radiology, that's a clear one. There are many algorithms out there, not just that we as a company produce, but the market has a lot of algorithms that help you to maybe see something earlier or see something better than the human eye would do, right? Our chief medical officer, he always uses this analogy of 50 shades of gray, not the film, but your eye can detect 50 different shades of gray if you are a trained radiologist and you are in a certain age. An algorithm or computer can do 250 or even more, right? So there is already a superiority by the computer, and they don't need that much sleep like human beings. They need basically energy and data to do that. So the second point is, what does it do? I think triage is one, augmenting capabilities of a radiologist or healthcare professional is another one, and then automating redundant or non-value-added tasks like the measurement of certain lesions. These kind of things are very prominent in the radiology space. And last but not least, reporting is also one where you can standardize mainly as a way how reports are written and also how data is captured. That then again plays into the data generated you need to train algorithms. So these are fields where we are very interested in. One is for sure producing our own algorithms. The second point is to help to bring the algorithm into the workflow of a healthcare professional. That's where we as GE have a great interest in being part of the journey.
A journey indeed. And, you're such a storied company at GE Healthcare, going right back to Edison, even part of the name of your digital health platform. So you've seen it must be an amazing to be part of such a storied company. So talk about that balance. How do you balance the needs of the practitioners with the technology, where you have this incredible AI capability that can automate and make life easier for like a radiologist workflow. But isn't it a balance, between enhancing rather than complicating the life of a radiologist? And how do you strike that balance?
I mean, that's already a real good point you made there. Technology always uh, is perceived as being the solution. Many times what happens is you implement the technology, and you can take this from your daily life as well, and you have to first learn it. It's not making your life easier from day one. And
Mm,
in GE Healthcare, we recently issued a study where we talked to many healthcare professionals and to patients, two of them, that's the main stakeholder in the healthcare systems, let's say. And actually 47% of clinicians find that medical technology in general is not easy or intuitive to use. That's already a first statement there, Evan, which I think is important. You provide
mm,
them with a solution, and actually it's making their life more complicated. That's the first perception. The second one regarding to AI, the same healthcare professionals said that 58%, so nearly 60% said, I do not really believe the AI outcomes yet. I still,
mm,
I feel more comfortable in diagnosing myself. So a first message there is that you don't innovate just for the technology's sake, right? This has to be integrated seamlessly into the way of working of the healthcare professional. In radiology, whenever you give them an additional screen to look at, another app to open, another algorithm to basically open,
mm.
they likely will not perceive this as an augmentation of their way of working, right? And they even refuse sometimes. So first message here, you are right, there is a balance. Whenever you integrate it into the workflow seamlessly, that in best case, that they don't even notice that the algorithm is there, that's where adoption of these kind of tools start. And I just told you the kind of statistics out there that actually say, hey, be careful with these applications, because likely they are not perceived as a value add. If this is the case, likely healthcare professionals will not use them. How do you get around that? I believe you should bring them in very early, even in the design process of algorithms, to say, hey, I make you part of my of the idea I have when I create an algorithm, to not develop something that's maybe off market.
Oh, wonderful thought. Switching gears a bit, the Edison digital health platform is making a lot of waves. Lots of interesting applications and use cases. Really, it seems like a whole ecosystem being built around digital health and AI. Can you shed some light on the platform and maybe some successes so far?
I mean, look, the platform will be likely a part of our RSNA communications. What I think is very important to notice at this point in time, Evan, is that first of all, companies are more open for collaboration in the healthcare
Mm,
space. That's something. It would be arrogant to say you can tackle all of the issues our sector has, and there are many, right? We have a shortfall of 10 million workers by
mm,
2030, if you believe communications. We have burnout due to overload of work. We have an access issue, right? More than half of the planet has no access to basic healthcare. So if you would say that one company can solve that, this would be just a statement which I would not buy into. So the first idea is that you bring together various parts of the ecosystem, where some could be basically technology partners, others are independent software vendors, third ones is industry, to work together on certain problem statements. That's a good idea that I see already happening quite a lot, because at the end, the orchestration of these algorithms will be a big one, right? So we ourselves, I think the FDA approved number is above 50 at this point in time in terms of on-device algorithms that the FDA approved in GE Healthcare. There are roughly, I think, 600 in total out there. These are right now working basically on some of our devices. The idea would be to make them accessible to the ecosystem, right? In this kind of approach. And yes, the platform is something we are developing at this point in time in helping to aggregate data and bringing these data points together to, at the end, generate insights that then are applied in the way of working of healthcare professionals. By now, and you know that, I mean, the average hospital produces 50 petabytes of data. That's a number I frequently use.
Wow.
If you would now, that's always the question I ask to people, if you would capture these 50 petabytes in the most analog thing out there, which is books, guess how many books you would need?
Good trivia question. We should do like a Jeopardy kind of music here. Yeah.
I mean, that's, I tell you the answer. It's
Yes, please.
it's 8 billion books, more or less.
Oh my goodness, that's a fascinating fact. Wow.
53 times the British Library, which is the largest library on my side of the planet.
Wow.
If you are now the healthcare professional searching for one sentence that should help to diagnose or cure or treat your patient, the answer is it's nearly impossible, correct? To basically, that's where AI gets very powerful. Algorithm can run through these data points very quickly and basically identify patterns or nuggets of wisdom you could use in treatment. And that's what this entire notion behind the platform is. Bringing these now separated data silos together, extracting the data, bringing it somewhere to an aggregated state where you can work with it to then basically apply AI to find hints that help you to treat better, or in the future even to prevent, right? Because that's where our sector should go in the long run, to not just treat and diagnose, but help to prevent diseases. And you will hear for sure more in the next couple of weeks and months about that.
I bet. Well, clearly part of your strategy is efficiency and scale and innovation, which is wonderful approach. Of course, that translates into very tangible benefits to the healthcare providers and the practitioners. What about patients? Where are they in this equation, and how do you take into account patients and the patient experience into this whole strategy?
That's also a good one. And I can just, again, make a little bit of advertising to our Imagine Better Health study here, where we talk to many patients to get to results. Some of the, I mean, the problems out there are clear, right? One is access. You basically, half of the planet, 3.8 billion people lack access. If you believe certain statistics of the World Health Organization. What's more interesting is if you see other statistics, people actually want to interact already digitally, right? And because you know that from your day-to-day life that it's possible. I always make the best example, which is traveling, right? I go down here, I take an app, I take a scooter. With this scooter, I drive to the train station where I go to a train, and then I go to the airport and fly somewhere. I do all of that without interacting with one person. I can see in real time the costs of the trip, if something is delayed or not, and I can take a coffee and wait, and so forth, right? And the first time I see somebody is likely in the security check-in at the airport. Sometimes even that is automated today, where you don't need to interact with people. Try the same in healthcare. Difficult. Getting your data from one point to the other, a difficult one. Knowing how much this costs, a difficult one, right? So these are all facts where we are used to a certain kind of luxury and behaviors from our consumer world that is not yet materialized in healthcare, right? And that's where I think it will go in the future. You as a patient will need to take part in your care pathway. There's this notion of the smart connected patient, where people are already claiming this kind of access and are helping in sharing data and going there. But that's where I think a lot will happen in the near future, right? Things like patient portals are important here. Whenever you also need, where you yourself generate outcomes as a patient in tracking yourself, right? That's something that you will see more and more. There's also healthcare shifting outside of the of the hospital even more. There's a company called AliveCore. They provide a 6-lead ECG machine where you can measure your ECG at home. I mean, the normal average device in the hospital is 12 leads. So you have now at your hand of your fingertips, like this size. You can do an ECG from home that then tells you, hey, you have to travel to see your cardiologist or not. If you see where this happened in the past, I think Mr. Einthoven, who invented the ECG, he needed an entire room to fit his machine in there. Now it's in your pocket. And that's where the patient comes into play more and more. So they will generate themselves outcomes, and they will be part of the diagnosis even without going to the hospital. And this puts companies like ours also in the let's say position to embed them in our thinking. Right, our traditional let's say client is a hospital, but we have patient advocates in our company. We have people who are both GE employees and patients at the same time, who are driving this concept. And a lady I always like to mention here is Cecilia Olsen. She herself is a person, a cancer patient, who basically we have the luxury that she works for us as a company, but she's also a strong patient advocate. She's telling her story outside where technology could have helped and where it helped basically to public, because I believe that this is one of the most important things, is also education out there. What can technology do? What can it not do? Right? If you now come back to AI, I believe that at some point in time, patients will request that AI is part of the diagnosis or even treatment. Why? Because you have these additional quality check built in. Coming back in radiology, if the human eye sees 50 shades of gray and an algorithm can see 250, both looked over the scan, I would feel more secure, honestly speaking. And that's what I also believe in the future. Patients actively will claim that that technology is part of their care pathway.
Well, it's a wonderful sentiment, and you're bringing it to reality. And it sounds like you're active in like predictive analytics, something we use in manufacturing and other areas, not as much in healthcare. Do you think that will be another way to optimize health system operations, is through that kind of predictive big data analytics approach?
For sure, it depends always where you apply these technologies, right? For me, everything which is service related, we know from other industries like the airline industry and so on, that you use this already. Same you can do with MR, CT, ultrasound machines out there, right? You can basically say, hey, you can measure certain kind of movements and then say, hey, it's likely that I send out a technician earlier to avoid that there's downtime, right? So in the predictive maintenance part in service, it's a full part of the portfolio. You also can, in a completely different sense, Evan, which I always like to talk a lot about, is in detecting so-called no-shows, so people who are not showing up to exams, and that's today a big burden to the healthcare system. If you take the NHS, even before COVID, they had more than 1 billion, let's say, costs to the system due to no-shows, to people are not showing up, because 8 million appointments were missed in the UK in 2018. If you take how much that is in other terms, it would be 250,000 hip replacements, more or less, or a little bit more than 900,000 cataract operations. That's the equivalent to 1 billion pound, right? And that's only happening because people are not showing up to the exams. There's technology that can address that, right? You can have an algorithm that takes into account the patient history, certain patient demographics, and also can take into account real-time data like traffic or like weather, to then predict, hey, it is very likely that this individual will not show up on time or will show up late, and you can act accordingly. Not showing these kind of slots to the individual when they book, sending reminders, all of these things that you know from other industries as well. This can also apply to healthcare. That's for me a very powerful solution, right? Predicting that somebody comes late to basically keep the the machine occupied, or the time of the healthcare professional occupied. As I said, this is technology that's already available, and where I believe we will see more of those. Because at the end, the worst thing is if a slot that could treat somebody is not taken. To give you also a very hard fact here, in the UK, the waiting list today is 7.7 million people who are waiting for treatment. Right? There's a
Wow.
backlog which was pushed through as well through COVID, because in COVID, it feels like the pandemic is over. It is over. It's not a pandemic anymore, but the kind of, let's say, symptoms are still there. We didn't treat certain kind of people for quite some time because the healthcare system focused on preventing COVID, right? So this didn't mean that people get less ill. So there's a backlog of operations and of treatments that still are now a burden to the system. If you can basically reduce downtime with algorithms like the one that I just explained, that's very powerful, I believe.
Powerful indeed. Well, what a fascinating approach. Uh, I guess as a final thought here, it's as an independent observer of tech, it's wonderful to see everything coming out of GE Healthcare. What's it like inside? What to describe for us outsiders the culture and the camaraderie and how you work together internally at GE, what that's like on a day-to-day basis.
I have to be very honest, I'm biased here.
Of course.
After nearly 12 years, as I said, it's difficult to basically say what's happening outside, right? I spent some time some years in consulting before I joined GE, so I have an overview of also of different industries and of different players out there. What I appreciate is our is the international and diverse culture that we live, right?
Mm,
For example, my team, I'm based out of Germany. I lead a global team, which is diverse in terms of gender, diverse in terms of age, diverse in terms of backgrounds, which is
mm,
this is something which I appreciate a lot. We also think that this makes our culture, right? To take into account diverse opinions is very powerful. I am working basically also for a company that's global. This was one of my main reasons why I joined 12 years ago. I lived half of my life outside of the of Germany, and then now I'm back here. But I like a lot this kind of interactions with global folks, which we truly have. G is a big ship. We have more than 50,000, let's say, employees, which also helps you many times in having an expert to
mm.
um, to discuss with. I like this kind of exchange that we have in the healthcare space. What else can I say? I think we have faster decision making in some points than other companies have. So there's a quite flat hierarchy, which I appreciate in the way of working. These are all things why I'm still here after 12 years, right? So it's a very nice environment to be in, where at the end, as I said, diversity is a big one for me. The other one is a kind of global reach, which I always enjoyed in working quite a lot. And then also in my case, look, uh, if you can prove that there's, for example, an idea and you can back this up with certain kind of outcomes and statistics, you always get a seat on the table, which I also think is an important one.
Indeed. Well, it's really been exciting for me to chat, and it's going to be really fascinating to watch RSNA and all of the insights and details that come out of the big show. So we'll be watching, and thanks so much for your time and interest.
Thanks for having me again. Talk
And
soon.
thanks everyone for watching. Reach out to Simon. He's prolific on social media, and I'm sure we'll get back to you with any further commentary or questions you might have. Thanks everyone.